So Tarun wants to know whether the session is in a clinical manner, right? So for your INI-CET exam, like over the past 4 to 5 years, whatever questions they have asked on the high yield points, okay, that we are going to revise through. Quick discussion, we'll do it, okay? So it's 9, can we start? Good evening, Panimalar. Good evening. Shall we start, guys? Ma'am, 9 ஆச்சு ஆரம்பிச்சிடவா? இதுக்கப்புறம் ஸ்டூடெண்ட்ஸ் வந்தா they can join, right? இப்போ இவங்களை வச்சு ஆரம்பிச்சிடலாம். Okay, ma'am. Thank you. Yes, Panimalar. Okay, guys. So we'll start today's session. Yes. So, right. Okay. Yeah. So all of you have decided to write for your INI-CET. Yes. And today, next 1 to 1.5 hours, okay, they told me like to finish at 10:30, okay, to revise, to discuss the anatomy questions which have been asked over the last 4 to 5 years, the recent papers in INI-CET exams, okay. So what did I go through? Like I went through the previous year question papers and found that you're with me, right? Yes. So what were the, guys, if you feel that I'm not audible, or if I'm a bit fast, you can let me know, okay? Yes? Yeah. So over the previous years, among the topics in anatomy, like every year, the more number of questions were like, of course, from the region of neuroanatomy, head and neck, including cranial nerves. And you know what? The next third priority was, it was histology questions, and along with limbs, okay, upper limb, lower limb, and of course there were few questions from thorax and abdomen. Embryology also was asked, okay, and like most of them image based questions, and undoubtedly like cadaveric images, but those are not like extraordinary ones, the most standard ones, and I think it has been covered in ADR, yeah, classes. Even our 6 a.m. sessions, we have tried to cover a lot of image-based questions. Okay. And few things that I understood over the while looking through these recent question papers is that, yeah, of course, neuroanatomy, the high yield points, the topic of interest throughout the years was definitely the same. Can you tell me what are the important topic of interest in neuroanatomy? Like every year, if you see, there were questions from, for neuroanatomy, I'm telling, okay, there were questions from cerebellum, okay, and then yeah, inevitably internal capsule was there, and blood supply of brain. But what they did, you know, they did ask about like separate different, they asked the blood supply of fornix, blood supply of corpus callosum on the medial surface of the cerebrum. The questions were a bit standard but very nice ones. And then functional areas, right? Neuroanatomy, these are the topics of interest. Okay, so you have to make sure you cover the topic of interest in each region in anatomy, right? And then image-based questions, as I told you, in the image-based questions, they're marked A, B, C, D, right? And if you could identify that A, B, C, D, then definitely you can work out the answer. So here, the important part is identification of the structure in the image-based question. And if you work out these routine or standard images, definitely you can click through that. And yes, yeah, options, like the difference between your NEET-PG and main INI-CET exams is that the options are like very narrow choices, okay? You'll be very much fingers crossed whether which one is correct. For example, there was one question, I'll tell you, which of the following muscle, it doesn't, okay, it does not cause overhead abduction. Okay, I'm just telling you the question, reason question. Which of the following muscle is not involved in overhead abduction? You know what were the answers? One was like trapezius, and the second one serratus anterior, and the third one pectoralis major, and the fourth one deltoid. So which one would you like to tick here? Yeah, pectoralis major. But what is the right answer, Panimalar? Yes, overhead abduction, right? Overhead abduction is mainly caused by trapezius and serratus anterior. Deltoid abduction is only up to 90-degree, right? It is not involved in overhead abduction, but still it is the abductor and not pectoralis major. Okay, so you have to be a bit wise while making the choices, right? And sequential arrangement. Yes, so there were many questions like with sequential arrangement. For example, what is the array? Answer is pectoralis major. Pratesh, okay. Serratus anterior and trapezius, they cause overhead abduction, 90 to 120, 90 to 180-degree. Whereas deltoid is only up to 90-degree, right? 90-degree of abduction is by deltoid. And deltoid does not cause overhead abduction. For example, if there's another answer, if there's pectoralis major is not there, only these three options are there, you have to go ahead with deltoid, right? But pectoralis major is that, and pectoralis major is a adductor, not abductor. Got it? Okay, coming to the fourth point, while thinking about your INI-CET exams, sequential arrangements. For example, like they have asked arrangement of structures in the hilum of the lung from anterior to posterior. Okay, and then you can get a like a secretomotor pathway for the parotid gland, that arrangement from the nucleus, the preganglionic, the ganglion, the postganglionic fiber, and even testes, they've asked the arrangement. I put that question in the session. The arrangement of the cells in the histology section of the seminiferous tubule from basal to luminal aspect. So there are a lot of answers with sequential arrangements. Okay, so when you're learning, concentrate on those also. Okay, we'll move on to today's session. Yes, guys, ready with me? So as I told you, neuroanatomy, the topic of interest over the years is like cerebellum, cerebellum, cerebellum. At least 5 to 6 points you should definitely know in cerebellum. Okay, you're with me? Can you tell the answer for this question? What are the cells present in the molecular layer of cerebellum? Yes. So what are the options given? Stellate cells, basket cells, Purkinje, and granule cells. So what are the three layers in the cortex, cerebellar cortex? You'll have an outer molecular layer, yes, and middle Purkinje cell layer, and inner granule cell layer, right? Inner granular layer. Now tell me, what are the cells that you see in the outer molecular layer? It's the, yes, stellate and the basket cells. Am I right? Okay. What do you get to see in the middle Purkinje layer, which is a very frequently asked topic, right? It's the Purkinje cells. And what do you get to see in the inner granule layer? Yes, GG, Golgi cells and the most numerous granule cells, right? So now what is the answer? Stellate cells and basket cells, right? Okay. Now, yes, very good. Panimalar and Mohan Raj, very good. Very good. Okay. Now, of the next thing that you should know, of all these cells, only one is going to be excitatory. You know what? Which one? You have seen like 5 cells, right? Of the 5 cells, only one is excitatory. The cell that is excitatory is, yes, come on, tell me. Very good, Mohan Raj, the granule cells. All the others are inhibitory. Yes, inhibitory. Okay. Yes, the Purkinje cells are inhibitory to which? The Purkinje cells are inhibitory to the deep nuclei of the cerebellum. That was one question. Okay. So you should know what are the layers What are the cells in each layer? The 5 cells, which is excitatory, which is inhibitory. The second point, or the third point that you should know about the cerebellum is the afferent fibers. What are they called? They are given different names, right? Interesting names. What are they? Climbing fibers and mossy fibers. What are these climbing fibers? Where do they come from? The climbing fibers are very unique, right? They come from the olivary nucleus or the accessory olivary nucleus, right, in the medulla. And what are these fibers called? The afferent fibers, the olivocerebellar fibers and the par-olivocerebellar fibers. Then what do you mean by mossy fibers? All the other afferents to the cerebellum, which includes the, yes, your spinocerebellar tract, anterior posterior spinocerebellar, vestibulocerebellar, reticulocerebellar, all the other, whatever you name it, okay? All the other afferents, all of them are going to be mossy fibers. Now, what is special about these? Okay, what is special? The climbing fibers, okay, the axons of these tracts, they come and end where? In the Purkinje cells. Okay, they are ending over the Purkinje cells. 1:1, monosynaptic contact. Each fiber will be in contact with one Purkinje cell. Okay, monosynaptic with the Purkinje cell. Now, what about mossy fibers? Each fiber will come and will be in contact with thousands of Purkinje cells indirectly through the granule cells. Okay, so that is the main difference between climbing fibers and mossy fibers. Okay, any doubt so far? Yeah. Now, can you identify the nuclei here? You see a cross section of the cerebellum, right? What is this nuclei pointed out? Can you tell me? Yes. A crumbled bag appearance, or you want a better picture? Can you identify this? The deep cerebellar nuclei. I'll put the numbers. You have to name it, okay? 1, 2, 3, and 4. Yes, Panimalar, 1 is dentate nuclei. Okay, the Purkinje cells, the axons of the Purkinje cells are the only output. Okay, only output of the cerebellar cortex. Right? Very good. Okay. So 1 is the dentate nucleus, the nucleus of the neocerebellum. 2 is emboliform, DEGF, right? And 3 is the globose nuclei. And 4 is the fastigial nuclei. Right? Yes, you should be able to identify it. The main output is via the dentate nucleus as the dentatorubral and dentatothalamic fibers, isn't it? Okay. Yeah. What are the signs of cerebellar lesion? Because they can give you a histology picture of cerebellum. And here in the options, you'll have cerebellar lesions once it has been asked like that. Yes, you have a mnemonic to remember it. Come on, do it. Let's do it. So vertigo, ataxia, truncal ataxia, right? Nystagmus. I stands for intentional tremor, slurring speech or dysarthria, and hypotonia, very characteristic of your cerebellar lesion, where you get the flail joints, weak joints, that will result in the pendular knee jerk. Remember the pendular knee jerk and exaggerated broad-based gait, staggering gait, and dysdiadochokinesia. Apart from that, yeah, we have the pass pointing test, the finger nose, the heel knee test, all that. Okay. Yes. So this you have to know, right? Have you taken it down? You want me to wait it or you're okay with it? Now we'll see a few questions. So we're seeing the layers of the cerebellar cortex, the 5 cells there, which one is excitatory, which one is inhibitory, the 2 types of afferent fibers, the deep cerebellar nuclei and the cerebellar lesion. Okay. Yeah. Now tell me, the following cell, that is the Purkinje cell, is inhibitory too. They've asked recently over 2021, right? Very good, Panimala. That's the deep cerebellar nuclei. Good. Next one. Yes, Shivashankar. Yeah. True about the lesion of the structure shown in the histological image? Yes. So that's again the cerebellum. You see the outer, yeah, the outer layer. This is the outer molecular layer, the middle Purkinje layer, the inner granular layer. So which is the feature of cerebellar lesion here? Truncal ataxia. Resting tremor is seen in Parkinsonism, right? Very good, very good. Okay. Now, moving on to the second topic in neuroanatomy, the internal capsule. Let me see. It was recently last year asked, right? You want to make a try at the answer? The correct statement about internal capsule. Charcot's artery, it supplies posterior limb. Retrolenticular part contains optic radiation. The anterior limb has corticospinal fibers for upper limb and face. Internal capsule has projection fibers. There are multiple correct statements, right? Okay, you want to identify the wrong statement? We'll put incorrect statement. Yes. We'll see some discussion and come back to this question. Why, Panimala? What type of, the cerebrum has white matter, right? It has commissural fiber, yeah, projection fiber, association fiber. What do you mean by projection fiber? Projection fiber is something which starts from the cortex to the subcortical area. Now, where is this internal capsule starting from? It's starting from all lobes of the cerebral cortex, right? It starts at the corona radiata. Heard about it? The corona radiata from different aspects of the different lobes of the cerebrum, they converge as internal capsule. And this internal capsule in the brainstem, what is it going to do? It's going to further converge and form the crus cerebri of the midbrain. Okay, internal capsule is an example of projection fiber. Fornix is also an example of projection fiber. Okay, got it? So first point 4 is right. Okay, so we'll go to the option 4. Internal capsule as projection fibers. We'll take it off. Okay, it's not incorrect. Then, what are the parts of internal capsule? Before that, this image is very, very important. Can we identify a few things in this image? You're with me. Can you tell me what is 1? What is 2? What is 3? Come on. 1 is corpus. This is a horizontal section of the brain, right? 1 is corpus callosum. What is 2? This empty space I'm putting here 4. That's the lateral ventricle. Isn't it? Guys, are you there? Some response? Yeah. What is 2? 2 between the two lateral ventricle. What is it partition there? 2 is Panimala, Tarun, Shivaganesh. Guys, are you there? Am I audible? Very good, Monica. Very good. Okay. 2 is the partition between the right and the left lateral ventricle. Septum pellucidum. Right. What is 3? From the septum pellucidum, the upper attachment is going to be the undersurface of corpus callosum and the lower attachment will be fornix. Very good, Danish. Fornix, right? Okay. Now this part is over. This is again the splenium of corpus callosum. Okay. Now I'm going to erase this part. Okay. Okay. And I will go to the next one here. The more important one. What do you see here? These are parts of your basal ganglia. This is the caudate nucleus. The head of the caudate nucleus you can see here. And what is the submerged cortex here? That's the insula. Right. Now you see a gray matter here. That's the claustrum. This white matter outside the claustrum, we will be calling it as extreme capsule. Remember it? And the white that lies inner to the claustrum, we'll call it as external capsule. Okay. Now, what is 1, 2, and 3? This one here is the lentiform nucleus. And 2, which is bit paler, what we'll call it as globus pallidum. And guys, tell me, what is 3? 3 on either side of the third ventricle, 3 is? Very good, Shivashankar, thalamus. Now, where is the internal capsule here? Yes, so this is the internal capsule. What are the parts of the internal capsule? It will have a anterior limb, the genu, the posterior limb. It will also have the sublentiform part and the retrolentiform part, isn't it? Right? Now, what are the fibers passing through the internal capsule? This is very important because only the lesion then we'll be able to tell, right? So what are the motor fibers passing through the internal capsule, right? You have the corticopontine fibers. We need not very much about it. We are concerned about the pyramidal and the extrapyramidal fibers. What are pyramidal fibers? The pyramidal fibers are further divided into corticonuclear and corticospinal fibers. What are corticonuclear fibers? The nuclear fibers are the one which are going to, from the cortex, they are to end in the head, the cranial nerves for the head and the neck. Okay, so they are for the head and neck, and the corticospinal fibers, they are for the upper limb, for the lower limb, and for the trunk. The extrapyramidal fibers will be the one beginning from the red nucleus, striatum, all that. Okay, so where are these located? You know, there's the anterior limb, the genu, the posterior limb, right? So the genu will have the corticonuclear fibers for head and neck. Is it okay? Okay, the genu will have the corticonuclear fibers which are going to carry the nerves for the, for the muscles for the head and neck. Okay, in the posterior limb, you'll have fibers for the upper limb, lower limb, trunk, and also the extrapyramidal fibers. So we are very much concerned about the genu and the posterior limb blood supply clinically. Okay, and coming to the sensory fibers, the sublentiform part will have the auditory fibers. It's close to the temporal lobe, and the retrolentiform part will have the optic radiation. Okay, so these are the most important. Now coming to the blood supply of internal capsule. Yes, so we'll go with the artery wise, that will be easier. Okay, so anterior cerebral artery, middle cerebral artery, posterior cerebral artery, easy. Okay, middle cerebral artery is the main artery. What is this going to do? It's going to supply mainly the posterior limb. Now you know what is there in the posterior limb, right? The corticospinal fibers for the upper limb, for the lower limb, for the trunk, and for the extrapyramidal fibers. Okay, it also supplies the anterior limb and part of the genu, middle cerebral artery. Okay, now coming to the anterior cerebral artery. The anterior cerebral artery is mainly meant for the anterior limb, but it also goes to supply the genu. The posterior cerebral artery, it supplies the sublentiform part of the internal capsule and the retrolentiform part of the internal capsule. Now, apart from this, I'm going to tell you 2 additional points for the blood supply. Okay, what is it? The genu will get direct branches from the internal carotid artery, and the sublentiform part will be supplied by the anterior choroidal artery also. I'll repeat this part for you because it's very important, because the occlusion of the artery only is going to give you rise to the symptoms that you're going to see. Anterior cerebral artery, middle cerebral artery, posterior cerebral artery. Middle cerebral artery is the important. It's going to supply mainly the posterior limb in addition to anterior limb and genu. What do we get to see in the posterior limb? The corticospinal fibers for the limbs, the upper limb, the lower limb, the trunk, and the extrapyramidal fibers. Okay. Also the anterior limb and genu. Then coming to the anterior cerebral artery, that's going to mainly supply the anterior limb, part of the genu, and you know the part of the genu has the fibers for head and neck. right? So you have to be much careful. Genu is also being supplied by the branches directly from internal carotid artery. Posterior cerebral artery, what is it going to do then? It supplies the sublentiform part, retrolentiform part. Anterior choroidal artery, sublentiform part. Now there are two eponyms. What is Charcot's artery? Yes. The middle cerebral artery will have a lateral striate branch, which is very thin walled. Okay, very thin walled. And whenever the pressure is going to rise, it's going to rupture. Okay, and that's called the Charcot's artery of cerebral hemorrhage. Right. Okay. Now another eponym. From the anterior cerebral artery, there's one artery which is long and takes a recurved course. It's called the recurrent artery of Hubner. Okay, that goes to supply the anterior limb. Now, what we are worried about is the lesion. Okay, now if there is occlusion of the middle cerebral artery, what is the patient going to present with? Yes, he'll be having contralateral plegias, right? It will be affecting the limbs. So hemiplegia, paraplegia, right? Mainly the movement of the limbs, the trunk. What will happen if there's occlusion of the anterior cerebral artery, which has the fibers for head and neck? Then there'll be contralateral paralysis of the face. Okay. What about the sublentiform and retrolentiform part? Sublentiform will present with auditory defects. Retrolentiform part, we have the optic radiation passing through, right? So contralateral homonymous hemianopia, visual defects. Is that okay? Yes. So what have we seen about internal capsule? We saw it is the projection fiber. We saw the parts of internal capsule. We saw the fibers passing through internal capsule, the blood supply and lesion. Now we'll go to the question again, recently asked question. So internal, now you can tell me the answer. Internal capsule as projection fibers. Charcot's artery coming from the middle cerebral artery, right? That supplies the posterior limb. The retrolenticular part has optic radiation. Sublentiform part or auditory radiation. Now, what is the incorrect statement? The anterior limb doesn't have the fibers for upper limb and face. Where is the fibers for face present? In the genu. Upper limb is in the posterior limb of the internal capsule. Is that okay, guys? Yes. We'll move on to the next part. Any doubt? Are you there? Yes, come on. Yes. Monica. Guys, what is the market appendage here? Panimalar, what is the market appendage? Good, you're making a, yeah, I'm happy you're making an initiative to answer. Yes. Yeah, that's what I told you, right? Neuroanatomy, head and neck, and a lot of histology questions. And the histology questions is very basic ones, okay? Yes. So the market appendage, you tell me what is it? Yeah, very good, Mohan Raj. Yes, it is a cilia, right? Very good, very good, very good. Yeah. What else you can see here? You can tell me what is this cell here? This is the goblet cell. Can you identify it? Yes. You see a goblet cell, you see a ciliated epithelium. Can you tell me what epithelium is this? Where do you find it? Goblet cell, you get to see in two areas, right? Yeah, in your intestine, small intestine, but more numerous in the large intestine. Yes, in your respiratory epithelium. But what is present? Cilia is present in the respiratory epithelium or in the intestine? Respiratory epithelium has cilia. Whereas in the intestine, you get to see the microvilli. Amava, right? So this is a picture of the respiratory epithelium with the cilia, with the tall columnar cells, with the goblet cells. Now you have a doubt, right? Where is the cilia absent in? None of you got it right. You want to make an attempt again? It's not D. You want to give one more chance? You want to try? Yes, Mohan Ram. Very good. Okay. Cheers. Right. So I'll just give you a basic thing. It was asked in 2020, right? So something related to that. So what is cilia? Cilia are long finger-like projections. They're going to be motile. What is stereocilia? Microvilli. Microvilli are also their projections on the cell surface. They are non-motile. Then what is the purpose of these microvilli? They are going to increase the surface area, isn't it? What is stereocilia then? Stereocilia are longer microvilli. Okay, they're given different names. So stereocilia also, they increase the surface area. Now, please note down, okay? Where do you get to see cilia? Yes, of course, respiratory epithelium, which means that in the trachea, in the bronchus, not in the bronchioles. Okay, guys, are you there? Wide awake? Elithikonga star potu. In the trachea, you'll see it. In the bronchus, you'll see it. Okay, in the extrapulmonary bronchus, bronchioles la cilia kedayadu. Right. Okay. And next, in the fallopian tube, you know what is the epithelium of fallopian tube? Anyone who wants to try it? Fallopian tube, what is the epithelium? Come on. Guys, come on. Basics, okay? Yes. Very good. Oh, very good. Simple columnar epithelium. Very good. Okay. The fallopian tube is called the oviduct, and of course, in the ventricles of the brain, the ependymal cells will have cilia projections. Okay, the ventricles of brain. That's why I put the ependymal cells. Okay, with cilia. Now moving on to microvilli. Microvilli, where do you get to see? Yes, in the small intestine, right? In the large intestine, and yes, gallbladder and kidney lenga in the proximal convoluted tubules, not in the distal convoluted tubules, okay? In the proximal convoluted tubules of the kidney, you get to see microvilli, okay? Gallbladder is a typical brush border appearance. In small intestine, it will be a striated appearance. These are the areas where you get to see microvilli. Stereocilia, very important. Where do you get to see stereocilia? In the male reproductive tract, okay? Please note it down. In the epididymis, in the vas deferens, and the hair cells of inner ear. Okay, guys? Hope I'm not very fast. Please put a stop or pause button, okay, when I'm fast, okay? Okay, cilia, microvilli, stereocilia na basica enna enga irukkudu. Is it clear? You should know about it. Okay? Okay with it? Some response, guys. I'm not able to see your faces, okay? Something you have to let me know. An indicator that you've understood, okay? Yeah, this is a picture of the... Thank you, Mohan Raj. This is a picture of any idea you must have seen in your first MBBS. You might not have seen it after that at all, right? This is the vas deferens, okay? Remember, it has a star-shaped lumen, a thick musculature. This entire thing is the muscle of vas deferens. You would have learned it's a muscular tube, right? This is a thick musculature. So it has a pseudo-stratified columnar epithelium with stereocilia. Pseudo-stratified columnar. This is the epithelium of the male reproductive tract with stereocilia. Vas deferens, right? This one, just now I told, right? It's the fallopian tube, which has the simple columnar epithelium with cilia. Okay, this is how it looks. There is a lot of folds within the fallopian tube, right? Yeah. So these are the mucosal folds. That's how it looks like. Okay. So as I told you, simple columnar epithelium with the cilia, fallopian tube. Simple columnar epithelium with microvilli. We saw in the intestine, right? Small intestine, gallbladder, and the proximal convoluted tubules of the kidney. Simple columnar epithelium. Please write it. Uterus. Endometrium of the uterus is lined by simple columnar epithelium. Okay, right? These are all basics which they can ask, high chances of asking. Okay, now what is this slide? Yeah, can you identify what this slide is? I put it in different views. This is the slide of kidney. Okay, you see the cortex here. The darker part that you see here is the cortex. This paler part is the medulla. What do you get to see in the cortex? Yeah, recently NEET-PG they asked, right? Cortex la enna irukum? All these round, all these round are the renal corpuscles, right? Renal corpuscles. And inga irukradellame vandu pathina the loop of Henle, the thin loops of Henle, the collecting tubules and the collecting duct in the medulla. Yes, Mohan Raj. Okay, so I put another simple picture here. Yes, so the renal corpuscle, as you see here, which has the Bowman's capsule lined by the simple squamous epithelium. Ada thavara cortex la you get to see the PCT and DCT. These are simple cuboidal cells, okay? As you see here, they're just simple cuboidal cells, okay? But what is the difference? What did I tell you? PCT, DCT, rendume cuboidal da. But edula microvilli irukku? Microvilli is present in PCT, right? Very good, Mohan Raj, okay? Yeah, so simple squamous epithelium, you can tell blood vessels, the tunica intima of the blood vessels, mesothelium, as I told you, Bowman's capsule or a parietal layer, loop of Henle. Okay, now simple cuboidal epithelium, give me examples. Solunga. Simple cuboidal epithelium, where do you get to find it? Thyroid follicle. Yes, ovary. Uterus enna paathom, simple columnar epithelium. This is ovary, the surface of the ovary, simple cuboidal epithelium. And then PCT, DCT we can add. Then the ducts, the smaller ducts of any glands will be lined by simple cuboidal epithelium, right? Okay, this was one INI-CET exam question, okay? Can you identify the slide? At least I need 4 people to answer. Apna da proceed panna mudiyum. Come on, Mohan Raj, Panimalar, yes, Monica, Shivaganesh. Identify the slide. I think the labelings will help you. Yes, Rahmanullah, very good. Good, Rahman. So that is testicles, okay? Yeah, so everyone agrees testicles. You see the Leydig cells, seminiferous tubules there. Okay, now this was the question asked. Arrange the following cells in basal to luminal side. Recently, November 22, right? Okay, so I'll tell you. You're with me, right? Yeah. So we saw a lot of sections of seminiferous tubule. Here one has been zoomed, right? So what do you get to see here? I'll put it here, right? So you see the pink basement membrane. Basement membrane therida. Basement membrane veliya, can you see this flat nuclei outside the basement membrane? That's the myoepithelial cell or myoid cell. Okay, it's found in very few areas now. Sweat gland la irukum, inga irukum. Okay, myoid cell, myoepithelial cell outer to the basement membrane. Inner to the basement membrane, what do you find? Okay, you're only going to give me the answer for this question, okay? Immediately inner to the basement membrane, close to it, you get to see the spermatogonia cells. Okay, diploid or haploid or spermatogonia? Solunga, spermatogonia cells. And inner to the spermatogonia cells, what you get to see here will be the primary spermatocyte. Please make a note of it. In the primary spermatocyte are the largest germ cell and they are diploid. Very good, Shivashankar. Guys, are you with me? Enna paathom basement membrane, outer to the basement membrane, myoid cell. Inner to the basement membrane, we saw the spermatogonia, right? Spermatogonia is the primary spermatocyte and then the secondary spermatocyte. Secondary spermatocyte enna problem appadina, they rapidly enter second meiotic division and they complete the second meiotic division quick. So paakradhe kashtam. Okay, but this is the order. And inner to the secondary spermatocyte, you get to see the spermatid. In the round kutti ellame vandu spermatid. In the section la illa lumen vandu free ah irukku, but here you can make it out. See the clump here that you see here within the lumen of the seminiferous tubule is the mature spermatozoa with the tail facing the lumen. Okay, அதுதான் உள்ளார இருக்கிறது, innermost. So we'll do it again. You see the basement membrane, outer to the basement membrane, the myoid cells, right? Inner to the basement membrane, what is the series? Spermatogonia, primary spermatocyte, secondary spermatocyte, spermatid, spermatozoa. இதுல எது பெருசு? The largest germ cell is primary spermatocyte. Got it? And within the lumen, you see the mature spermatozoa with the tail facing the center, right? So you'll tell me the order. Yes, come on. 1, 1, 1. Second. Yes, 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 yes. What is the answer? Myoid, basement membrane, spermatogonia, primary spermatocyte, secondary spermatocyte, spermatid, spermatozoa, right? Yes. Did you get it, people? Very good, Shiva Shankar. Okay. Now tell me, Leydig cells enna secrete பண்ணுது? Leydig cells are going to secrete testosterone. Cherry, there's one interesting cell there, right? Did you appreciate it? Sertoli cells. Did I put a picture here? Inga theriyunda, Sertoli cells are nice pyramidal shaped cells. Here. They appear a little paler than that. Okay, paler than the spermatogonia. What is the function of these Sertoli cells? They are also called nerve cells. What hormone do they secrete? Sertoli cells are going to secrete AMH, anti-Mullerian hormone. Embryology, people. Embryology, anti-Mullerian hormone. Another important function. They contribute to the blood-testis barrier. Heard about it? And they are phagocytic in function also. Okay, so idella Sertoli cells patti, I mean testis histology patti kandipa therinjirukano. Okay. Okay, now moving on to questions in head and neck. Easy. Nerve emerged at the market point, like last year, right? This question. What is the nerve that you see emerging at the mark point? Easy. Come on, Rahman, Mohan Ram. Yeah, that's the sixth nerve. You have no doubt at all. Okay. As I told you, image-based question, the image structure identify panitali, you'll get it right. Okay. So here, what are the other things you're going to see here? Come on, tell me, what is this? This is the olfactory bulb and tract. This is your optic nerve. This part is the optic chiasma. Right? This is the optic tract. What is this bulge that you see here? That is this is your hypothalamus region, right? It's the hypothalamus region, right? What is this bulge that you see here? That's the tuber cinereum. What is this? The mammillary body. So these are all parts of the hypothalamus. Now coming to the cranial nerves and the brainstem. Yeah, what are the cranial nerves related to midbrain? Yes. So this is the region of the midbrain. What is the cranial nerve related to it? Can you tell me what is this nerve? Midbrain mattu, Mohan Ram. Yes, Shiva Shankar. So this is the third nerve. You see, this is the crus cerebri. Medial aspect of the crus cerebri emerge agradhu, third nerve. And this is the frequently asked one. From the dorsal aspect of the brainstem, pinnadi irundhu munnadi varudhu enadhu? That's the fourth nerve, the trochlea nerve. You should be able to identify it, right? Very good. Okay. Now coming to the pons. Pons la inga poradhu basilar sulcus. You can see the basilar artery here. This thick nerve, the largest cranial nerve which emerges from the pons, ventral surface of the pons, is the trigeminal nerve, right? And the pontomedullary junction, yes, as you told, this is the sixth nerve, this is the seventh nerve, this is the eighth nerve. 6, 7, and 8. Yes. Any doubt? Yeah. Okay with this? Now a closer picture into the medulla, right? Yes. Now you'll tell me. I'm going to just number it. 1, 2. What is 1 here? 1 is, come on, there was a question recently asked. 1 is, very good, pyramid. 2, another, 2 is olive. What do you get to see below the pyramid? The corticospinal tract, right? So what will happen if there's a lesion of the pyramid? Yeah, lesion of the pyramid will lead to contralateral hemiplegia, right? Olivocaudillar inferior olivary nucleus. Now coming to the cranial nerve that you see here, what is this sulcus called? What are the cranial nerves that you're seeing emerging from here? The